This conference will now be recorded.
Then you will read this one, then I will go to the next one. Okay. You finish reading this one, then I will take it to the next one.
Okay.
Okay, dear, finish reading.
Yes, sure.
Okay, so you can start just 1 minute. So you have read the scenario. What will you like to ask her? What will you like to ask her?
Okay. Name, age. You have name, age, aperitif, last menstrual cycle. It is regular or irregular.
Okay.
History of present illness since when she had this complaint, the bleeding, the painful bleeding. If she searched any medical advice or no, if she did any operation regarding that, if she's on any medications, OCP or any medications, um, um, medical history of hypertension, thyroid, heart disease, surgical history, gynecological history, gynecological operations before, family history of similar condition, or ovarian cancer, colon cancer, uterine cancer, breast cancer, cervical cancer, sexual history, if she has a multiple partners or no, social history, drug history, allergies,
Okay.
a pap smear, a recent pap smear if she did.
Okay. So after that, what will you discuss the procedure to the patient?
Patient in the ultrasound, they said there is submucosal fibroid.
Okay.
She can have the option of a hysteroscopy, myomectomy,
Okay.
because it is submucosal. So we can do it through hysteroscopy. Or other option like myomectomy through abdominal myomectomy under GA, both of them under GA.
Okay. That is good. So what treatment options you can offer to this woman?
Sorry?
So what treatment options, what type of surgery you should ask her? If she
Option,
has this type of surgery.
you can have option of medication. You can give her medication to reduce the size of the fibroid together with the bleeding, like GnRH agonist. So she can have medical plan, uh, medical treatment, or surgical treatment. Surgical treatment through hysteroscopy, abdominal myomectomy,
Okay.
right?
Yeah. So then you should give a detail.
Sorry?
You should give some detail. What is the benefit of each intervention? What will happen if you will not offer the treatment?
The medical treatment, it's convenient for her, available, but we cannot use it for a long time, maximum 6 months. But for the surgical treatment, the hysteroscopy, short stay in the hospital, but maybe she will have a risk for uterine perforation due to the procedure, bleeding, infection, hysterectomy if needed.
Okay.
But
So
abdominal, also abdominal myomectomy, risk for anesthesia, risk for maybe she will have bleeding, infection, bowel injury, bladder injury, uterine urethric injury, bleeding. If uncontrollable, it can end by hysterectomy.
so look at the size of the fibroid. Is it easy to do surgery on such a patient?
It is big, too big. Posterior
Yes. So what done?
but the submucosal it is small, but the fundal too much big. It's big surgery, يعني.
Yeah. So what will you like to do before the operation?
Sorry?
So what should be done before surgery? Should we give her something to decrease the
So this,
size?
I told the medical, she can have
Yeah.
GnRH and analog GnRH agonist to reduce the size. Injections. It will be injection.
Yeah. That is the point. Okay. So what will be the benefit of injections?
to reduce the size of the fibroid and to reduce the bleeding during operations.
Yeah, that's good. So, and after this surgery, what are the risks of these procedures? If you will offer of any of these procedures, you should tell them that what will be the problem with that procedure also.
Which procedure you mean? The injections or the OR?
All. That if you do the surgical, because injection will not be procedure, right? You are giving injection because you will do something about the procedure. Before the procedure, you want to decrease the size like that. That is the point.
Okay, the procedure, she may have bleeding, infection, failed operation, and by the hysterectomy,
Okay.
bowel injury, uh,
Mm,
bladder injury, ureteric injuries, bleeding,
yes.
blood transfusion, admission to CCU or intensive care unit.
Yeah. These are the points. And how you can decrease the risk for her.
She should use this injection before operation. Check for hemoglobin before OR,
Okay.
and give her antibiotic during the OR. Good surgery experience. We need good experience, expertise. We need expertise for this OR.
Yes. Okay. You're right. You have mentioned many points. Let's go over it. Okay. So whenever you are, reading any question, you need to pay full attention. Okay. She's 40. She's nulliparous. Okay. She doesn't have any child, so maybe she will like to go for another. She would like to start her family or something. Then she's a smoker. For smokers, all risks they will increase. Okay. BMI 30, unhealthy, right? So she's not like, we cannot say that she is overweight, she is obese, because if the BMI is 29.5, it means she's overweight, but now she's 30 kg, BMI 30, so she's falling into category of obese patients. Then you look at the size of this fibroid. It's a big one, right? And she has got two fibroids here. So you need to tell her about all of these things. So you will say that I will take OB/GYN history. She's Nelly Paris, and that the thing I will ask her that she is fine, everything is okay. She doesn't have any other health complications. Then what is this fibroid doing to her? Is she having heavy bleeding, some problem, or what? Obviously, it must be causing pain, pressure symptoms. So you will take history for that one. So then, is she in a stable relationship, married, and she will like to have children? You need to explore her options, because then you can plan surgery for her. So do you need to rush to the bathroom all the time? Or then you should ask her that, do you feel constipation? She will give you the answer for that one, okay? Then you will say that, did they do any investigation on you to see the blood? Did they tell you what is hemoglobin level? Because if someone is having menorrhagia, HB should be low. Then, are you regular with your pap smears? She will say yes. So, are you regular with cervical smears? She will say yes. Okay. When was the last one? Okay, you will confirm the date. Okay. Then you will say that we can offer you different surgical procedures. Like for the small one, we can simply put a scope inside you. So basically, you should tell her from the start that we can do two or the different procedures. Like now she's asking for the surgical procedures, okay, not the medical one. So but still you should ask her what treatment you take, what benefit was there. Okay, so now you want to go for surgery because treatment is not working for you. So if we put one camera inside you, and then we can take out this mass in the from down below, but for the larger one we will have to offer open surgery. So basically you have two options. We will just have a look at this one and we will try to shave them and take them out. You know, even for the large fibroid, you can do this morcellation and you can take it out because you will remove as much tissue as possible. Okay. But this procedure, it has certain complications also, like we can curve, like we may fail to take out the whole tissue, whole of this mass. Then you can say, then we can, sometimes there can be puncture into the wall of the womb, which can cause severe bleeding, and then we will have to open the tummy. So these are the problems. Okay. Second option is that we open your tummy and then we open the womb and we take out this mass. Okay? We will not say that fibroid because patient maybe she will not understand. Say mass. Okay. So the problem with myomectomy is that if we will cut the uterus, the womb, then if you plan to, it is a major surgical procedure, you will need to be admitted to the hospital, you will have to stay hungry, and then what will happen in between, you will say that I will tell you about them also. That is one thing. Then another option is that we remove the womb and leave the neck of the womb in place and remove the tubes and the ovaries, and I will tell you about that also. Another option is that we should take out the whole of the womb and we should remove the tubes and the ovaries also. Ovaries, they will understand if they ask what is ovary, from where you are getting your eggs. Other option is that we should block the arteries which are feeding these masses. And the last option would be that if you are happy with your situation, then we don't have to do any surgery. Let me tell you about the risks of all of these procedures. For all of these procedures, you can have some problems immediately. First of all, in the pre-operative management, I will have to see that what risk factors you have. In your case, your weight is on the bit higher side, then you are a smoker, and both are risk factors for the surgery. So I would like you to stop smoking and reduce your weight, okay? And after that, you will say that I will take consent from you because I will explain all of the problems to you. You can have venal complications when we are giving you sleep medicines, okay? Sleep medicines when means the anesthesia. And then because it will be done under general anesthesia where you will be totally sleeping, duration of surgery can be like 1.5 hours or more. So this is important for you to know about all the problems you can have. So then don't tell about the risk of GSA, that it is a long procedure, so you will be under the effect of medicines. We can damage the organs around the womb, like your gut or your bladder. Then you can have severe bleeding during the procedure because the size of the fibroid is very large. And then the problem is that if we, in some of these procedures, like if we are scoping you, we are looking from down below and taking out the fibroid. In that case, this procedure can fail, or or we can make some hole into, we can puncture the womb, then we will have to open the tummy and do the needful to close that gap. And then sometimes if we fail to take it out from down below, then we will have to open the tummy and take it out through the womb, through the abdominal route. So before operation, you will need antibiotics, you will need admission, you will need to sign a consent form. Like I'm explaining all the risks and benefits to you, so you should understand the procedure and the benefits and the risk associated with each type. Then we will give you antibiotics, you will have the surgery. I'm going to be your surgeon, but I will do it with the help of a senior consultant. Then after the procedure, then we may need to leave some drains behind. After the procedure, what you can have, you can develop a blood clot in the leg veins, you can have problems with your water works, you will need antibiotics again, you will need painkillers, and then after that you can develop infection at the site of the operation. Then in the long run, you can again form the blood clot in the next 6 weeks, and then you can develop the problems with your water birth. And if we are removing the womb and the uterus, then the womb and the fallopian and the ovaries, then you may have developed some stress that you are not a woman anymore, which is a wrong imagination. So let me tell you about the advantages and disadvantages of the procedure. Hysteroscopy, which is not very destructive, It is not going to cause many problems, but the problem is that you will need more procedures, because I am taking out just some of this tissue, so maybe pressure symptoms will improve, maybe they will not improve. If I will take out only the fibroids, then the benefit is that you will be able to conceive, and you should understand the chance of hysterectomy, because in cases where the massive bleeding occurs during the surgery, then I will have to remove it. And then you should say that the problem is that if I will do the subtotal hysterectomy or total abdominal hysterectomy, the first problem for such women will be that they will have surgical menopause. That you will have surgical menopause, which means that you will not be having any periods anymore. So you will need to have some hormones for the next 11 years, because you should know the age of menopause is 51.4. Then you can have some problems in the postpartum, in the if we will just leave the partially removal of the womb, then you will have again premature menopause, and then you can have you can have slight bleed during the time of periods. And then the problem is that you will have better sexual function as compared to the total removal of the womb. And then the cervix is left behind, so you are at risk of developing a cancer of the cervix, and you will have to go for routine screening procedures also. Okay, so I have given you a lot of information. I will give you this patient information leaflet. Go over them, read about them in your free time, and if you have any questions, feel free to ask me, and we will try to do the best for you.
This conference will now be recorded.
So, what points are how you will take relevant history?
Name of the patient is, if she's married or not, parity, last menstrual period, regular or irregular, if she's on a contraceptive, any method, uh, if she's history of present illness, since when she had this problem, if she bothered her life, if she seek for any medical advice before, um, medical history of hypertension, thyroid, heart disease, surgical history of any operations or gynecological operations, family history of similar condition or cancers, ovarian, uterine, cervical, breast, social history, uh, and if she's a smoker or no, um, sexual history, allergies,
Okay.
a pap smear, if she did pap smear, recent pap smear, and the result if it is available.
Okay. What else?
Anything more?
Yeah. So, what investigations you would like to discuss with her?
Investigations. So, a complete blood count, coagulation, beta HCG, liver function test, renal function test, pap smear if not done.
Yeah. What else? Maybe you will need to exclude infection.
Sorry? Gene swab, hymen swab, the cervical swab
Yeah.
test, I remember. Chlamydia and gonorrhea.
Yes. Okay. So this is history. So what else you would like to do on examination?
Examination, a general examination, see height and weight, BMI, pressure, vital signs يعني head and neck, breast, head and neck and أيوة breast. Then I will see if there's any masses in the breast. Then chest examination, physical examination, abdominal examination, inspection, palpation, any sign of palpitation before any masses, any tenderness. Then I will take her يعني I will take her agreement for general examination for inspection from outside. Then we can use general speculum to see the cervix. Then we can do a PR also. Lower extremities. If there is any varicose vein, any edema.
Okay. So, what will be the appropriate management option for her?
Management regarding defining cause. We see what had caused, what is the causative of intermenstrual period, then we can manage. If it is due to infection, we will say infection. If regarding any medication, we can adjust the medication she used, like aspirin or pills. We can this.
Okay.
Then regarding underlying cause, and here in the history, in the examination, the cervix looks normal.
Okay. So, what else do we need to do for her? She's 34, she has IMB. So, what possible diagnosis comes to your mind? You know, they have told you that pelvic examination is normal and the cervix is also normal.
You cannot do ultrasound pelvis to see the ovaries and the uterus.
Yeah.
Ultrasound. Here we didn't do ultrasound.
Yeah. Yeah. Okay, let's go over it. Okay. In the exam, they will ask you about more common conditions. Okay, you are getting patients all the time with PID, vaginitis, like that. So history, you should say, you should say, many students, they complain that when they go for the exam, and they will say that I will introduce myself and this and that, then, sometimes the examiners are not very happy. They will say, why are you wasting time? You will say you should just go and say that I will tell that they will say that how you will start. I'm Dr. Amal and I'm here to ask you some questions. Okay, just say like that. Okay, I'm Dr. Aveda and I'm here to ask you some questions. So just confirm the biodata that you should know that you are talking to the right person. And then you should take the history of the presenting illness, complaints, that for how long she has been having this bleeding. Then ask her that did you ever have bleeding after having this sex? Then, any other history of any other problems, like they told you that she's on she's has this history of epilepsy, she's on carbamazepine, and then do you want to consider any other form of contraception? Because if you will always read the question very carefully like that, okay? Because this question, they said that she has IMP, and you should ask her that is she taking any form of contraception? Anything like here they have written.
Non epileptic patient, this one.
Yeah, this one. If you will ask that any medical problems, anything, only then the examiner will tell you. And
No,
are
no,
you
here
taking?
the question, the
Yeah,
scenario, the
yeah,
scenario. Patient, she has
yeah. That's
she
right. Yes. So always very important to ask her. She's 34, right? Are you taking any contraception? Everything is normal, okay? are you taking any contraception, then important to ensure that she's taking that in the right way. Because if you take in the wrong way, then she can also have bleeding. That is the point. Okay. That is one thing. So that is one of the considerations, that is she taking contraception, she is on pills, so maybe she's not taking regularly. Any medical history of significant, are you generally fit and well? She will tell you that she's epileptic or she's having some problem. Investigations, you will say that you will do the general physical examination, then you will do the pelvic examination, and you will take any smear and exclude any local pathology. Then you are justified in saying that you will arrange an ultrasound scan, and then you do the blood tests are not necessary because the history is not telling you that she has heavy bleeding. Okay. So after that, you will say that OCPs, maybe she's taking the which are not enough, and then maybe she's not using them appropriately. So we need to increase the dose of combined oral contraceptive pill. And then we also need to consider the different types of contraception. So we will not give her progesterone only pill because she can have bleeding on that one. Because the most common side effect of giving progesterone only pills is irregular or breakthrough bleeding, right? So we can give her the Depo-Provera. The first option will be that you will increase the dose of combined oral contraception. We can give her Depo-Provera Implanon, and if she has completed her family, throughout we didn't ask her that how many children she has, because maybe she has completed her family, she's 34, right? Like that. After that, maybe we can offer her other options like sterilization also. See, so you will have one impression that maybe she has only STI. You will take the swabs also for that. But there can be many other reasons. So very important to ask any bleeding patient who is in the young age. First option is, but she has intermenstrual, so you will not think about the pregnancy, but still you should ask her that are you using any contraception? Because if she is not using contraception, then you can ask about the pregnancy test and stuff.
This conference will now be recorded.
Okay, we can start. So we'll take history from her. Because she's post surgery, right? She is post surgery, so this is like breaking bad news, something to her.
Okay, name, age.
Okay.
Since 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 when she had this complaint, the vaginal bleeding, if she seek for any advice before, any medications, if she has a plan to get married soon or not, um, some past medical history, hypertension, thyroid, heart disease, family history of similar condition, and cervical cancer, endometrial cancer, breast cancer, ovarian cancer, uh, social history, drug history, allergies.
Okay. So how you will explain the diagnosis?
This she has endometrial hyperplasia, increased cells in the endometrium.
Okay.
Then she can this one endometrial cancer.
Yeah. Yeah. So how you
And
will say, you will ask her that.
cancer, and her life
Mhm.
is priority.
Yes.
Then we should do this one hysterectomy. Hysterectomy with sorry, we should do a total hysterectomy plus
Yeah.
bilateral salpingectomy.
Yeah.
This is her management
Yes.
with the staging.
Yeah. So basically, here you should get a role player.
Uh-huh.
That is the point.
I think this case it came in our exam last year, but I don't know how to real approach to this one.
Okay. What?
This station it came in our exam last year. Same
Yeah,
bed.
that's why it is here. Yes. But that one was that one was the stage one, right? She's 39 and early, and she has COCPs, and then this is adenoma.
Okay.
So, okay, no problem. Let's go to that one. Okay, let's do the station, then I will tell you something. So you
To
say that, yeah, yeah.
in
Continue,
the
please. Please continue.
role player يعني we should ask her also the history ولا على طول we are going through break bad news.
Mm-hmm. Yeah. So this is because and okay, this is like breaking bad news. So you will say that you will go and you will because the age of the patient is relatively young. That is the point. But endometrioid cancer or adenocarcinoma, it can occur in any age group. Okay. Then you should remember that clear cell carcinoma, it can occur in view of endometriosis. Your patient has endometriosis, she can develop it. That is the point. Okay. So you will take the menstrual history. You will say I will confirm the demographics. So say I'm Dr. Hueda, and you are Aman, and you have this problem. Then you know why I'm saying Aman. Her name is Khulud. Okay, Khulud, and do you know who has so tell me about your. Can I ask you some questions? You will say, tell me about my diagnosis. You will say, yeah, sure, I will do. But do you mind if I ask you a few questions before we do that? So tell me about your previous history. Why you had this surgery? What was the problem? What was going on like that? Okay, all of these things. So tell me about yourself. What happened? Tell me about your menstrual history. Were they regular, or did you have like bleeds for long periods of time? So any medicines you have been taking. So what have you been taking in the last 2 months? She will tell you something. Then you will say that any history of significant, any history of any medical disorder like do you have diabetes? Do you have sugar? You are a smoker, nulliparous. Then any family history of cancers. So do you want to have more children? So will you like to have children? So what about your social history, social sport? Do you work? What do you do for a living? Do you have good sport? So are you happy at home? How are things at home? And then you will say that how are your parents and the siblings? So any other problem, any other operations in the past, anything you would like to tell me? Then you will say that have you come alone or someone is accompanying you? She will tell you that no, I have come alone. Then you will say I'm sorry, I don't have a good news for you. He will say, no problem. Tell me what has happened to me, what's wrong with me. And then you will say that I'm sorry that I have to tell you about this disease. So the problem is, do you remember that we removed this tissue from you? So we have taken out this tissue and we have seen it, and it looks like you have some cancer of the lining of the wound. So I'm sorry that I have to tell you, and how far it is spread, we have no idea. So for that, we need to do the staging, which is surgical. So we need to refer you to the multidisciplinary team, which is going to assess you before, and then they will carry out further testing on you. Like they will like to have a look at your tummy, your womb, and the organs around it. In detail, we will do some investigation. We call it magnetic resonance imaging. You will not have any harm because of the investigation. So in this situation, usually what we need to do is that I'm sorry to inform you that we will have to take out the whole womb, the tubes and the ovaries, and then even something we call lymph node because they can contain the cancer cells. We need to take out all of these things. So this is going to be a big surgery. We will have to give abdominal incision. We will have to give a cut on your tummy to take out this womb. And this is a major surgery. You can have problems when we are putting you down to sleep, and then you can have develop a blood clot on the leg veins. Then you can have injury to the bladder, to the bowel. Then after the surgery, you can have infection at the site of operation or any other area in the body. You can have bleeding. You can have fevers. You will need to take the medicines. And then the multidisciplinary team, they will review you and they will see that is it possible to take out the worm through the buttonhole or what. And then the problems are that I'm sorry that, but the problem is that your life is more important than having this worm, and so you will not be able to have your produce children. You will have the menopause, and then you will have to take the hormonal therapy for like next, I can say that for next 11 years, so that you will not have any other problems like feeling hot or having low mood or making the bones very soft, so you will not take these problems. So then these when we will give you low dose hormone, it also has some problems, but they will be given by someone who is expert in such matters. So let me tell you that 85% of patients like you, they are going to live for easily for 5 years or beyond. That is quite possible. So then, after removal of the womb, we will send it for further assessment that what is the actual stage of your disease. And after that, you may need radiotherapy. What is radiotherapy? That you use the radioactive waves to burn the tumor cells in your body. Okay. And but the requirement that you need it or you don't need it, it will depend upon the results of the lab. And like they will have a look at the tissue with the help of microscope, and then they will know for sure that what type of problem you have, what type of cancer you have. So then, since this is cancer, so within 31 days we need to start the treatment. So do you have any other problems? You have any other questions? Ask me about it. Then you will tell her that I understand that this news is very bad for you. This is devastating. Maybe you had plans for your pregnancy and other things, and now they will be compromised. But really, I'm sorry that I had to give you this news. But there is no way out. This is the truth. So I will give you patient information leaflet. I will put you in contact with other patients, and then I will tell you that how you can cope with this stress. There are many help groups. I will give you number of this help. So do you have any questions for me? Okay, if you have any questions, ask me, and I'll be happy to answer them for you. Okay, that's how you will close that, and I will make arrangements for your referral, and I will document everything in your notes. So if you have any questions, please ask me. Right, so